Hello folks, today we're going to begin to talk about the home health aide and the role that the home health aide plays in the healthcare team. And so we're going to have a discussion about that in this PowerPoint. So these are important terms. I'm not going to read through them. Just know that they are important and play a large role in healthcare and will help you become more familiar with healthcare in the home care setting. So the first thing that you have to understand about healthcare is that it is a very dynamic and changing field. In the old days, like this slide says, that people used to pay for home care out of their pockets. There was no insurance. And after World War II and the 60s and current day, there's been a lot of change about how we pay for health care. Healthcare can be a very expensive portion of a group's budget, and we need to embrace change, as the statement by Socrates says. Without change, we don't develop better things, and so that's important. So healthcare can be provided in a number of different settings. As this slide says, lots of people access healthcare through their doctor's office. The majority of people who have insurance tend to go to a regular doctor on a regular basis and get that healthcare in the doctor's offices. Sometimes people need to use and utilize clinics as a non-emergent way to provide care when they aren't able to necessarily pay for it in a doctor's office. Emergency room is literally what the word means. It's in an emergency. Unfortunately, however, there is a group of the population that needs their health care done from the ER because they have no other option. And that's a very sad statement on society today. So as I stated earlier, home care can be provided in a number of different settings. People get health care in hospitals. They get them in nursing homes, as you saw last year. They may get health care in a rehabilitation center. We are moving away from those models. In certain situations, you can't get away from them, but ideally a person would like to be cared for in their home. And so now home care is being brought to, health care is being brought to the homes, and you are seeing a large increase in the population who are receiving their care at home. There are lots of different people who provide care in the home. You tend to see some of these people more frequently in home care, whereas others you might not see as frequently. It's a very rare exception to see a doctor in the home, but there are still doctors out there who provide health care to patients in the home when they're not able to get out of their homes. They are a very small group of people. They are often assisted by physician's assistants or nurse practitioners. The bulk of the home care work and care provided in the home is done by nurses, registered nurses, and LPNs, CNAs, and home health aides. Sometimes you will have speech therapy or physical therapy in the home as well. Certain agencies specialize in providing that care. Others tend not to. But the focus of home care is the majority is provided by nurses and the nursing team rather than the physician. Healthcare is very expensive. As I previously said, that each patient used to have to pay for their own care. There were no insurance companies, and people had to pay out of pocket. So if they didn't have the money, they didn't get the services. Now things have changed. Over the years, we've developed a healthcare system. It's still undergoing overhaul. And there's lots of different ways to pay for health care, either a government-sponsored program, an employer-sponsored program, private insurance that you pay for yourself, the exchanges at the moment, or people may just get services through Medicare or Medicaid. There are lots of ways to pay for home care. Some examples include private or employer insurance, like I said earlier, health maintenance organization or companies run by doctors that you have to see a specific doctor based on the HMO or a PPO where you can pick any doctor as long as you stay within that PPO. If you go outside of the PPO, you have to pay extra. So as I stated earlier, healthcare is very expensive, and there is a number of ways that healthcare is paid for. For the older population, the bulk of the healthcare is paid for, believe it or not, by Medicare. And you guys have heard about it, Medicare. Medicare is a program set up by the federal government to pay for people who are over 65 and who are disabled. And depending on which part they are using, will be utilized by the agency to pay for the care. When people have home care and they are using Medicare, they have to be homebound. They're not able to get out and just go socialize on a daily basis, because Medicare feels that if they're able to get out, then they would do not need home care, and they will not pay for it. It will only pay for home care if they are homebound. It will pay for the care in the home. The other program that's used frequently to pay for home care is Medicaid. Medicaid is a program run by the state and federal government, and it pays for care for people who are disabled, who are in long-term care services. Is used a lot. Medicaid is used a lot to pay for that. In addition, health insurance may pay for home care, or the patient may have to pay privately. And you will find as you get into home care that there are a lot of patients who don't qualify for these first two programs I talked about, and they really need the care, so they're willing to provide and pay privately out of pocket. As I said earlier, health care is very expensive. A typical hospital bill can run on average around $1,000 to $2,000 a day, depending on what's going on in the hospital. People can wind up with very large medical bills. Nursing homes are just as expensive, although they're slightly less expensive than hospitals. So what people will do is they stay in their own homes and make arrangements for care to be done. And the insurance companies and Medicare, Medicaid, and state programs are now much more willing to pay for care in the home, because they don't have to keep those costs up of maintaining the facility and providing the food, because that is typically done by the patients in the home. In addition, some facilities, you run a higher risk of getting ill because of it, so that is a huge benefit to the insurance companies when they don't have to pay for care in a hospital or a nursing home, because the patient is less exposed to certain things and are less likely to become sick chronically. So it is a really good option, and people really want to stay in their homes. They don't want to leave their homes. They're used to their homes, so that's why the amount of people receiving care in the homes has now increased. And as you learned last year in your CNA class, the bulk of older people are cared for in their homes rather than in nursing homes. A very small percentage of the population actually gets care in a nursing home. Okay, so home care got its start in healthcare because prior to the Civil War, people would pay for doctors privately if they needed to, but if they couldn't afford a doctor, they had to have the family care for the patient. In the 1930s, as part of the Depression, federal money was used to pay for women to take care of people who were sick in their home because it was less expensive. In 1959, a conference like this says was held to help people talk about how people would care for people in their homes. In 1965, President Johnson started a federal program to provide health care. It also called for homemakers to become home health aides and care for them in their home. And finally, in 1999, Medicare and Medicaid both required that people who were working in home care would be required to have criminal background checks before working in home care. We've all heard the horror stories of people who have gone into homes and abused people and taken advantage of them. So now this federal requirement in order to use Medicare is that you clear a background check and a criminal check before you start working in home care. Like I said, home care is very expensive, And so there's different ways to pay for home care. Primary way to pay for home care and for people who are over 65 is Medicare. Like I said earlier, Medicare is a federal program that's used to pay for health care. Medicaid is a program that is managed by both the federal and the state government. It tends to be more for people who are disabled, for people who are older and need long-term care, and it is operated individually by the states, but the money comes from the federal government. State and local governments may also pay for health care. In addition, people may use their insurance company, which could be provided by their employer, or they may pay out of pocket for it. In addition, a patient may pay for care out of pocket for additional care that isn't covered under one of these other programs, and there are actually lots of people today who utilize private hire care, and so it is a growing opportunity for you as home health aides to be able to work in homes on a private duty basis, and you get to know those clients a little better, and the regulations can be a little different with those. So typically there's lots of different agencies out there that provide home health care. Many of them have different focuses. There is a huge growth in the home care industry today. Many agencies are hiring home health aides. Like this slide shows you, there's Albany visiting nurses locally. There's also aide visiting nurses, which is part of St. Peter's. In addition, there's hospice, and then there's many different private hire agencies that will use home care. In addition, assisted living will use, is considered home care because they don't typically hire home health aides, but they may hire home health aides on a private basis, or just somebody who gets some basic minimal training. You have to be very careful that you look at the agency and they're reputable and have good insurance, because your certification for home health aide or PCA is on the line based on that. But they provide a lot of services. They provide nursing services. They may provide physicians, physical therapy. They may provide home health aides, speech therapists, occupational therapists, and they might even provide hospice services depending on the goal of the agency. As I said in the previous slide, there's lots of different ways that home care can be provided. In addition, IV therapy, if a patient has long-term IV therapy, they may go home. Mother and baby and child services, education about nutrition, because we can manage our health care based on how we monitor our diet. In addition, they may do PCAs and HHAs. You guys are definitely going to be involved in bathing, checking vital signs, doing some meal preparation, housekeeping, and a different range of activities. Safety companion services, where you would just be in the house to make sure that the patient is safe. There is equipment rental as well, where home care agencies specialize in rental of durable medical equipment. Durable medical equipment are things like hospital beds, oxygen concentrators, and Hoyer lifts, and those things would be used to care for a patient in their home. Finally, it's important to realize that there are some huge differences between health care in facilities and health care at the home. One of the things that you might do in home care is wash someone's laundry, or wash their dishes, or do some light dusting. You'll have some professional relationships if you care for a patient on a long-term basis with the patient and the family, get to know them and how they live. You spend a large portion of the day working independently. You're not going to have a supervisor over you. It's important to keep in contact with your employer. You also have to be very dependable and have reliable transportation. Those are some huge advantages if you don't like caring for patients, 3 to 8 patients at a time, and you want to do individualized care that is more focused on the patient, then home care is definitely the right route. Hopefully this information has been helpful to you, and have a good day.